Hello, I'm Bill Connors, and today for the Telepractice Community June newsletter, we have the pleasure of talking with Dr. Todd Houston, and Sharon Rennhack, our newsletter editor, will be interviewing Dr. Houston. So Sharon, I'm going to let you go at it.
Hi, Bill. Thank you. Hi, Dr. Houston. How are you today?
I'm doing well, Sharon.
Today, as Bill mentioned, I'm interviewing you on how you got started using telepractice. We have on the screen some of your credentials, that you're a professor at the School of Speech-Language Pathology and Audiology at the University of Akron. And we know that you are also the director of the Telepractice and E-Learning Laboratory as well. And we also have on the screen some of your seminal books on telepractice in speech-language pathology, and telepractice in audiology. So my first question, Dr. Houston, is how did you get started as a telepractitioner?
Well, that's a great question, Sharon. And before we jump in, I just want to thank you and Bill for this opportunity to be with you today. And it's really an honor to be a part of the newsletter and to record this interview. So it's really quite an honor and a privilege. My start in telepractitioner, as a telepractitioner in telepractice, really started before I came to the University of Akron. I was actually on faculty at Utah State University in Logan, Utah. And frankly, I was asked to be a part of a program to provide services to children with hearing loss, which is my background, working with children and families that have hearing loss, as well as adults with hearing loss. And out of my efforts there and some research I was doing, I was approached about leading a new project that would be telepractice-based to test the feasibility of telepractice in Utah to provide those early intervention services to children with hearing loss and working with those families. We were just testing the feasibility of, could we deliver these services at a distance? Could we work with families? Could we coach the parents to, help reinforce communication with those children? And what we saw was that it worked very well, and we went from there to starting to look at other software and other ways of delivering those services. And as we were starting to do that, I came to the University of Akron, and when I came in and was interviewing for a faculty position here, I certainly wanted to continue researching in the area of telepractice, and they embraced that with open arms and said they would like to have some labs set up and to train our graduate students in delivering those services, as well as expanding our clinical services here, certainly within working with families of children with hearing loss, but also looking at adults. And now I have other faculty who have other clinical interests that are starting to use the equipment and to expand our services here, all through telepractice. So in a nutshell, that's sort of where we are now, 5 years now here at the University of Akron, and we're serving probably more than 20 or so families with young children with hearing loss. All of them have chosen a listening and spoken language approach, and so we're coaching those families to be great and those parents to be language facilitators for their children. And we're working with quite a few adults as well. Many of them have cochlear implants, and they're looking for some oral rehabilitation to expand their use of that technology, to be able to learn to use the implants better. And so we've been able to do some of that work through telepractice as well.
That brings us to our next question. How do you evaluate success and outcomes as a telepractitioner?
Well, I think we have to look at, are we being effective in terms of what's happening with our patients? And so I think evaluation of what we're doing on one level is, evaluating our patients. Are they making progress in the skills that we want them to make progress in? And then, so much of that evaluation is going to be through the patients and those outcomes. But as a professional, I certainly want to see, my skills continue to develop and make sure that I am doing everything that I can do to adapt treatment through a telepractice model. and that sometimes takes some thought and some effort. And then I also work with graduate students, and they help me sort of stay on my toes, because they'll come up with some great ideas and great ways of maybe providing some treatment, and we'll have to think through how we're going to do that through a telepractice model, and that keeps me on my toes. And so I think ultimately the success that you have is, are your patients actually experiencing the success? And if they're experiencing success, I think we're having a successful program.
Changes or advances in telepractice have made an impression on you?
Well, I think for me, everything has now gone to be web-based. As I mentioned, I started off with some large dedicated units that we put in the homes that were kind of big and bulky and awkward, and now everything has gone to basically laptop, software-based, internet-based. That is incredible in terms of some of the technology we have now, and so I think that's been a big leap forward. I think the continuing to see the growth in broadband. The availability of broadband connections, not only in the homes, but in other situations as well, other areas. I think the impact of social media and spreading the word and getting people online and connected, I think helps to reinforce this idea that people can receive other services like healthcare services through a telepractice model. And so I see a lot of these things happening that are moving us forward. I think more and more mobile technology with smartphones and tablets.
My next question for you is, what do you see in the future for telepractice, speech language pathology, and audiology?
Well, I see more of it. I think what we're going through is societal changes in terms of how we embrace and use technology. I don't see this suddenly tomorrow saying, the heck with all this technology, we're going to just go back. It's not going to happen. And I think it's going to be more services available to families at different times and different formats, and when and where they want to have it. And so I think we're seeing that revolution happen, that disruption happen in other areas of our lives, where we can sit at home and shop and do just about anything we want to do in terms of getting services to our home, we can do online. And so as we're seeing with medicine and other disciplines and other healthcare areas and even education, there's really less and less of a need to be sitting in the room with the person to receive speech-language pathology or audiology services. It's a little more difficult with audiology in some respects because if they're having to do testing and things like that, but needing a sound booth, but that there is more equipment needed with audiology. But I'm seeing more and more ways that audiology is adapting to be able to serve more patients, where they're setting up remote sites using audiology assistance, and the audiologist is miles away. They're controlling the computer at the remote site and being able to do some great audiological diagnostics, as well as screening diagnostics, as well as fitting and even programming of cochlear implants. And so that's something that we're experimenting with here in Akron, working with the Children's Hospital in Cincinnati, to look at some remote cochlear implant mapping for families that are local here, but are being served down there. So we're looking at some of that here. In terms of speech pathology, I just see it continuing to grow. I think in many aspects, in some ways, I think speech pathology is doing a great job in terms of telepractice, and then in other ways, I think we're just sort of getting started. And when we compare our discipline to some of the other disciplines who've been doing much more telepractice, and it's more widely available than some of these other disciplines than it is in speech pathology. So I see nothing but continued growth, and I think one of the big things that's holding us up right now is the reimbursement issues that we all understand, and some of the licensure issues. And I think what we're going to see going forward is that we're going to get some of those issues resolved, hopefully in the next 2 or 3 years. And my fear is after those issues are resolved, everyone's going to be jumping in and saying they can do telepractice by opening up a Skype account and starting to work with patients. And we all know that it's a lot more to it than that. And my fear is we're going to have a backlash. Saying, people are going to say, oh, it didn't work, and it's not for me, or patients saying it didn't work because they're getting services that are not at the level of quality we all want to maintain. And so those are some of the things I see going forward. Overall, very positive, and I just enjoy learning more about what other practitioners are doing, what other clinicians are doing, like you guys. And seeing how you're using technology to meet the needs of more and more patients.
That brings us to our next question and our last question. What advice do you have to the aspiring telepractitioner?
Well, a couple of things maybe. I think certainly try to network with as many people as you can. Talk with people that have been doing telepractice. Go observe them. Go to presentations at ASHA. Network through SIG 18. Look at these other resources that are available. It is more than just setting up a Skype account and starting to talk to your patients and work with them. You need training. You need to understand what your limitations are. You need to understand the needs of your patients and how can you deliver those services and meet the needs of your patients through telepractice. And you need to really explore all of those areas. And then I think one other area that I think we need to think about is hopefully we can get more university training programs in place that are adopting telepractice and that are including telepractice within coursework, within practicum, so that the next generation of people that are out there will come out of these training programs with at least some knowledge of where to get started and what should be ethical practice and best practice in telepractice. And so that's one of the things that we're doing here at the University of Akron, is trying to expose our graduate students to telepractice, service delivery models, and helping them become, hopefully, great clinicians, whether they're in person or through telepractice. And so those are the kinds of things that I think about in terms of advice, is to get more training, really do the networking, read, understand what you're getting yourself into before sort of jumping in.
Dr. Houston, thank you very much for this interview. You gave us some great ideas. Thank you.
Thank you. It's been a pleasure.
I'd like to wrap things up. Again, I also thank you for taking the time. I continue to recommend your textbooks. They still lay out the concepts and the ideas. So I recommend those to everybody. We're working with a couple graduate programs, and it's been fun. I've supervised students a long time, and I love how quickly they pick up the technology, the eye contact, the creating materials. It's been a good experience there. I'd like to also talk about your giving advice, that idea of peer networking and support and recognizing limitations, but also realizing the opportunities and the synergies. And it's really why we started the telepractice community, to try to do just that and network with people like you to get our speech pathologists in the trenches prepared before these things change, before Medicare approves telepractice and things. I hear what you're saying, so that's exactly what the newsletters are for. And there are more and more presentations at ASHA and state conventions. Sharon and I just presented at the Florida convention and the Illinois convention. So let's stay ahead of the game, and let's be ready, because it's gonna change even more.